So my presentation was about trying to understand better the functional characterization of the follicular lymphoma common precursor cells. So those cells are the ones that give rise to the disease, and they are present very early on in healthy individuals, and we know that some of those cells are able to progress into follicular lymphoma. And so it's very interesting when we think about interception of that disease to characterize at the genetic level, but also at the functional level, those CPC. And also, we know that those CPC are likely at the origin of the relapse. And so if we want to avoid and prevent relapses, we need to characterize them. So I presented yesterday a story that we conducted on a clinical trial where we were able to get access to samples at the diagnosis of the patient and after treatment. And after treatment, we believe when they are cured, or at least they are in remission, we believe that we can have access to an enriched population of eventual drug persisters and cancer precursor cells. And so we used fancy tools that are based on single-cell transcriptomics that allow you to analyze very rare population and to analyze the transcriptome of those cells and to characterize them. And we get access to those CPC after therapy, and we define a novel signature of those CPC, and it seems that the signatures that we have some specific markers that can be targetable. And so if we are able to propose some clinical trial, early clinical trial, in order to target specifically those CPC, we may, in the future, of course, prevent the disease relapses. And so this is really where we are right now, characterizing better the follicular lymphoma precursor cells and trying to find ways to target them. In addition, what we have done, we are working on the B cells, but we are also working on the microenvironment and characterizing the microenvironment that sustain those persister cells. So we have defined some characterization of the microenvironment, and we think that by targeting the crosstalk between the tumor and the CPC and the tumor microenvironment that sustain those cells, we can also find ways to eradicate those CPC and prevent relapses.